Over 100 years. Over 100,000 credentialed practitioners strong. Since 1917, we've faced and overcome countless challenges. The COVID-19 pandemic changed the world. Our jobs became more essential than ever before.
I'm currently Senior Director of Healthcare Centers and Schools, and that entailed caring for 40,000 kids in the Baton Rouge area. In the beginning of the COVID-19 pandemic, we were so uncertain about what was going to happen, and we felt that jumping in and really finding a way to help our community was going to be our primary concern. I was out in the community, standing outside, helping with COVID testing day to day.
I work for the city and the county government in Kansas City, Kansas. Overnight, I had to change my role completely. We turned our public health department's parking lot into a drive-through COVID-19 testing site. So I jumped on board and started assisting with that. I started assisting with contact tracing so that we can help prevent the spread.
So currently I work as the Director of Community Outreach for Culinary Health Education for Families, or CHEF. When the pandemic hit, we had to work quickly with our teachers to help them adapt to, instead of giving a food demonstration and a nutrition lesson in their classroom, they had to do it from their kitchen at home so that they could still do a live video with their students and make it almost as engaging as it was before, but at least the children were seeing a familiar face.
My job at the Auburn School District is the coordinator of child nutrition services. So since COVID, we've had to redesign the whole menu, not just in the food that we're making, but in the packaging and in the logistics to getting this food out to the community.
I work for Eat Well Exchange, and before COVID, my main job responsibilities were to coordinate and to participate in our kids' culinary program, also teach nutrition classes to low socioeconomic communities with a focus on culture. After COVID, had to turn a lot of programs into virtual services, and so we had to get our voice out there because we knew that COVID impacted so many of the people that we serve every day, especially high rates in the low socioeconomic community and minority community.
In our underserved communities, we are the first in and the last out, championing diversity at home, at work, out in the neighborhoods that need us the most, fighting for equity in our health and in our profession.
Underserved communities have historically been, on the other side of institutional racism, and as a result have had decreased access to healthcare, but also to so many other resources. Dietitians really have an opportunity to improve the health of a whole population, not just the person in front of us.
As a part of a local government employee, I can really be in the front lines of helping to fight for health equity, which is fighting for everyone to have the equal rights to health, including access to healthy foods, which I think is so important.
So at CHEF, we work with predominantly low-income families. There are so many environmental and other barriers to cooking a healthy meal. And so many people think that cooking a healthy meal costs so much more money. And what we do is we break it down and show them that there are some very simple and delicious, most importantly, ways that we can make a really phenomenal meal together in a short amount of time.
I've never felt more a part of the community since COVID happened. I felt like if we could at least cover the kids' food needs, that we could help these families in some small ways.
Having more dietitians of color out in the communities that we serve is so important because we know that racial concordance improves patient engagement, which improves patient outcomes.
So food is universal and food is culture. Food is our identity. So when you're asking a patient of yours to eat foods that they're not culturally comfortable with, never heard of, it's like you pretty much ripping their identities in. When you start to build rapport, you actively listen to them, you develop cultural awareness, you become culturally sensitive, then the tables start to turn where they feel comfortable with you, they respect you.
We know the impact of food. Good, pure, beneficial, balanced food. We know how it can change someone's life. We will rise up during a crisis because we know how to make the difference that could tip the scales in the right direction.
RDNs are some of the most adaptable and resilient people I've ever met. We have really worked so hard to come up with such great plans in every setting, whether that be private practice, school food service, clinical, or even from our home kitchens doing culinary classes.
So I think that this time is such an amazing time in healthcare. While it feels very scary and uncertain, and it has been exhausting and tiring, this is a great opportunity for us as dietitians to really step out and to pivot and find new opportunities for us to reassure our place in healthcare and to show here's why you need us. In COVID recovery and community response, there's no other profession more equipped than dietitians to do this.
The resilience and the creativity of dietitians and other nutrition professionals that we work with is really shined through.
Just know that this is definitely not a wasted year. This is a year where we've had time to reflect, to act, and I really think as dietitians, this has been a year for us to change for the better. This has been a year for awareness. I think that we should count 2020 down in the books to say this is a year where there was going to be a turning point, and I'm daring you all to do the same.